100 days into the lockdown, one nurse has described to eNCA how the fight against COVID-19 has become much harder. In March, President Cyril Ramaphosa announced the country would be under a 3-week lockdown. But that was extended several times, and the country is now under level 3, with the economy and schooling reopening in phases. This means more infections. eNCA's reporter Masego Rahlaga has the story.
Like many other nurses, Rich Siqina prays before his shifts at the Tel Hospital begin. This is because they're on the front line of the country's fight against COVID-19 and are worried about their safety. When we first met him at his home, he was making his way to work on day 1 of the lockdown. At the time, he said he was ready for the war.
I'm proud of myself. The country is facing a pandemic, a disaster that has a potential of wiping almost a million of South African citizens. And as nurses, we are trusted with our expertise, our knowledge, to be on the front line of defense. So I'm saying, let me go there, bring it on. Let me go there and protect our people.
This time, we meet him after a shift at the same hospital. He remains positive, but even more anxious now than before, particularly because he has buried colleagues who died of COVID-19.
It's very painful. I've already attended a funeral of a colleague who died because of COVID-19 related illnesses. It's a lonely situation. I feel like the public needs to know this. It's a lonely situation. Remember, to try to curb the spread of the virus currently, we don't allow visitors to come into our facilities. So if you are admitted, you are on your own. We are with nurses who are discouraged. We are with nurses who are forced to work even if they are positive. You are with nurses who are going to infect you, by the way. Those nurses, because there's no one from whom you are lonely. You'll be lonely until you go to your grave.
The Gauteng government says it's aware of the concerns from healthcare workers and is taking these seriously.
Yes, we've seen the strain, we feel the strain, and I think our healthcare workers have also actually indicated to all of us that they are feeling the pressure. I'm seeing a bit of a demonstration, and I think concerns being raised by our workforce, we take them serious, and we really address the challenges that they are raising. And some of the challenges that they're raising do relate to the usage of PPE, but by and large, the underlying fact is just a matter of the fear and anxiety that is actually creeping in.
With this war against the virus far from over, Siqina says all he can do is continue praying while trying to save lives. Masego Rahlaga, Phosphorus.